How would you assess a patient's home environment for safety risks?
In assessing a patient's home environment for safety, I would start with a comprehensive, systematic approach, focusing on identifying potential risks that could impact their health and recovery. My initial step involves a walkthrough with the patient or their family to get a first-hand look at their living space. During this assessment, I would pay close attention to fall hazards, which are a primary concern, especially for elderly patients or those with mobility issues. This includes checking for loose rugs, cluttered walkways, and poor lighting. I'd also evaluate the condition of stairs, ensuring there are handrails and that steps are free from obstructions. Beyond fall risks, I would assess the general cleanliness and sanitation of the home. This involves checking kitchen and bathroom areas for hygiene, looking for signs of mold or mildew, and ensuring proper waste disposal. A clean environment is crucial for preventing infections, particularly for a patient who may be immunocompromised or recovering from a procedure. I'd also look at fire safety, checking for working smoke detectors and an accessible fire extinguisher. Another key aspect is medication management. I'd assess how medications are stored and if there are any signs of misuse or a lack of organization. After the assessment, I would engage in a collaborative discussion with the patient and their family. I would explain my findings and provide actionable recommendations, such as suggesting the installation of grab bars in the bathroom or rearranging furniture to create clear pathways. I believe it's essential to not just identify risks, but also to empower the patient and their family with the knowledge and tools to mitigate them effectively, ensuring a safer and healthier living situation post-discharge. This proactive approach helps to prevent readmissions and promotes long-term well-being.
Describe your experience with chronic disease management in a home setting.
My experience with chronic disease management in a home setting has been focused on empowering patients to take an active role in their health. I've worked extensively with individuals with conditions such as diabetes, hypertension, and COPD. My approach begins with a thorough assessment of the patients and their family's understanding of the disease, their current management plan, and any barriers they face. This includes not just their physical symptoms, but also their emotional and social well-being, as these factors significantly influence adherence to treatment. For example, when caring for a patient with diabetes, my role extends beyond simple glucose monitoring. I educate them on the importance of diet, exercise, and proper foot care, tailoring the information to their lifestyle and cultural preferences. We would work together to create a realistic meal plan and a safe exercise routine. For a patient with COPD, my focus would be on teaching them breathing techniques, proper use of inhalers, and recognizing early signs of an exacerbation. I also conduct a home safety assessment to ensure the environment is free of irritants that could worsen their respiratory condition. A critical part of my work involves continuous communication and coordination with a patient healthcare team, including their primary care physician, specialists, and dietitians. I ensure that everyone is aligned on the care plan and that the patient's progress is regularly reported. I also teach family members and caregivers how to provide support and recognize when professional help is needed. My goal is to build a collaborative partnership with a patient, providing them with the knowledge and confidence to manage their chronic condition effectively, ultimately improving their quality of life and preventing unnecessary hospital visits.
How do you handle a change in a patient's condition when you're the only medical professional present?
When faced with a change in a patient's condition while alone, my first priority is to remain calm and assess the situation systematically. I rely on my training to conduct a rapid but thorough assessment, starting with the patient's airway, breathing, and circulation ABCs. I would immediately take their vital signs, perform a focused physical exam, and gather any additional information from the patient or family members present. This quick assessment allows me to determine the severity of the change and if it constitutes a medical emergency. Once I have a clear picture, my next step is to initiate a call to the patient's physician or the emergency services, depending on the urgency. I would use a clear, concise communication tool like SBAR, situation, background, assessment, recommendation, to provide a complete and accurate report. This ensures that the physician or dispatcher has all the necessary details to give me guidance or dispatch help efficiently. For example, I would state the situation, e.g., the patient is experiencing sudden shortness of breath, provide the background, e.g., she has a history of COPD, describe my assessment findings, e.g., Vitals are T99.8, HR110, BP 145/90, SPO 2-88% on room air, and offer a recommendation, e.g., I recommend an immediate evaluation and potentially an emergency transport. While waiting for help to arrive, I would provide appropriate interventions based on my nursing scope of practice. This might include administering oxygen, elevating the patient head, or providing comfort and reassurance. I would continue to monitor the patient's condition closely, noting any changes and being prepared to update the incoming medical team. Throughout the entire process, I document everything meticulously, including the time of the event, my actions, and the patient's response. My ability to act quickly, communicate effectively, and provide immediate care in a high-pressure situation is what allows me to manage these critical moments successfully.
What are the most important aspects of patient and family education in home health?
The most important aspects of patient and family education in home health center around empowerment and collaboration. My primary goal as a home health nurse is to ensure that patients and their families feel confident and capable of managing their health needs independently after my visits conclude. This involves a multifaceted approach that goes beyond simply providing information. The first crucial aspect is a thorough assessment of learning needs. I can't effectively teach if I don't first understand what the patient and their family already know, what they need to know, and what their preferred learning style is. This involves asking open-ended questions and observing their interactions. For example, some patients learn best through visual aids, while others need a hands-on approach, like a return demonstration for a procedure such as insulin injection or wound care. I also need to assess any barriers to learning, such as language differences, low health literacy, or physical limitations like vision or hearing loss. The second important aspect is to personalize education. Home health is unique because it's in the patient's own environment, which means the care plan and education must fit their lifestyle, schedule, and resources. I would not give a one-size-fits-all handout. Instead, I'd tailor the information to their specific condition and to their home environment, providing concrete examples. For a patient with a new diagnosis, I would break down complex medical concepts into simple, understandable terms, and then ask them to teach back the information to me. This teach-back method is a powerful tool to confirm their understanding. I would also involve key family members or caregivers in every step of the teaching process, as they are often the ones providing ongoing support. This collaborative approach ensures a seamless transition and ultimately helps prevent complications and hospital readmissions.
Tell me about a time you had to adapt a treatment plan to a patient's unique home situation.
I recall a specific case involving a patient recovering from a fall who required a home-based physical therapy regimen. The initial treatment plan from the physical therapist was quite structured, but it didn't account for the unique challenges of the patient home. She lived in a small, older home with narrow hallways, which made some of the prescribed exercises, such as walking with a walker, very difficult and even unsafe. The home was also cluttered, and she lived alone with limited social support, which impacted her motivation and ability to follow the plan. My first step was to perform a thorough reassessment of her home environment, which revealed the physical barriers. I observed how she moved around her space and identified the specific areas that posed a risk. Instead of trying to force the original plan, I collaborated with the patient and her family to make meaningful adaptations. We started by rearranging some of the furniture to create wider, clearer pathways. I then modified her exercise routine to focus on movements she could do safely in her space, such as chair-based exercises and gentle stretches in the living room. I also introduced household items as tools for her therapy, like using a sturdy kitchen counter for balance exercises. Beyond the physical changes, I addressed the motivational and social barriers. I broke down her exercises into small, manageable daily goals and celebrated each small victory with her to keep her encouraged. I also helped her connect with a local senior support group that offered transportation and social activities, which addressed her isolation. By adapting the treatment plan to her specific environment and personal needs, she not only became more adherent to her therapy, but also regained her independence and confidence, ultimately leading to a successful recovery and preventing further falls.
How do you ensure clear communication with the patient's physician and other members of the care team?
Clear and effective communication with the patient's physician and other care team members is absolutely critical for patient safety and continuity of care. My primary strategy is to use structured communication tools, most notably SBAR. SBAR stands for Situation, Background, Assessment, and Recommendation, and it's a proven method for delivering concise yet comprehensive reports. When I need to update a physician on a patient's condition, I first state the situation by identifying myself, my location, and the patient I'm calling about. Then, I provide the background, briefly explaining the patient's diagnosis and relevant history. Next, I share my assessment, including current vital signs, symptoms, and my clinical findings. Finally, I offer a clear recommendation on what I believe should be done next, whether it's ordering a new medication or suggesting an in-person evaluation. This systematic approach ensures that the doctor gets all the critical information in a logical order, preventing miscommunication and delays in care. In addition to using tools like SBAR, I also prioritize documentation and timely updates. I ensure that all my notes in the patient's electronic health record are accurate, detailed, and up-to-date. This allows any other member of the care team, whether it's a physical therapist, a social worker, or another nurse, to easily access a complete picture of the patient's progress. I also believe in the importance of direct, respectful communication. If I have a concern or a question, I will not hesitate to ask for clarification from the physician or specialist. Similarly, I make it a point to listen carefully to their instructions and confirm my understanding. Ultimately, my goal is to foster a collaborative environment where information is shared seamlessly, and every member of the team is aligned on the patient's care plan.
Describe your approach to accurate and timely documentation of patient visits.
My approach to accurate and timely documentation of patient visits is a systematic and disciplined one, recognizing that documentation is not just an administrative task but a critical component of patient safety and quality care. I prioritize real-time documentation as much as possible, completing my notes during or immediately after a patient visit. This practice helps ensure the accuracy of the information by capturing details while they are fresh in my mind, reducing the risk of memory-based errors or omissions. I always have the patient's chart or a secure digital device with me to record vital signs, medications administered, patient education provided, and any changes in their condition as they occur. To ensure my documentation is both comprehensive and concise, I follow a structured format. I typically begin with a brief narrative summary of the visit, followed by specific details using a structured format, such as SOAP notes, subjective, objective, assessment, plan. The subjective section captures the patient's own words and complaints. The objective section includes my clinical findings, vital signs, and physical assessment. The assessment section synthesizes this information to describe my clinical judgment and the patient's current status. Finally, the plan outlines the interventions performed, education provided, and any next steps, including a follow-up schedule. This method ensures all key aspects of the visit are documented in a logical, easy-to-read format. I also understand the importance of patient-centered documentation. Beyond the clinical data, I make sure to document any patient or family education that was provided, their understanding of the material, and any questions or concerns they had. This ensures that the documentation serves not only as a legal record, but also as a complete communication tool for the entire care team. It guarantees that everyone, including the patient's physician and other specialists, has a clear picture of the patient's condition and the care they received, which is essential for continuity of care and preventing readmissions.
How do you handle a patient or family member who is non-compliant with their care plan?
When I encounter a patient or family member who is non-compliant with their care plan, my first step is to avoid judgment and instead approach the situation with empathy and curiosity. I believe non-compliance is often a symptom of underlying issues, not a deliberate act of defiance. My approach is to find out why they are not following the plan. This involves having an open and non-confrontational conversation to understand their perspective, concerns, and any barriers they might be facing. For instance, a patient with diabetes might not be following their diet plan not because they don't care, but because they can't afford the prescribed foods, or the family's cultural eating habits make the diet difficult to maintain. A family might forget to administer medication due to a complicated schedule or a lack of understanding. Once I've identified the root cause, I work collaboratively with them to adapt the care plan to their unique circumstances. This is a crucial step. It's about making the plan work for them, not the other way around. If the issue is financial, I can connect them with a social worker or community resources. If it's a matter of education, I'll use different teaching methods such as visual aids or the teach-back method to ensure they fully understand the instructions. I might also simplify a complex medication schedule or suggest more manageable exercise routines. Ultimately, my goal is to transform the relationship from a directive one to a partnership. I make it clear that we are a team and their input is essential. I reassure them that it's okay to have challenges and that together we can find a solution. By establishing trust and showing a genuine commitment to their well-being, I can significantly improve compliance, which leads to better health outcomes and a more positive care experience for everyone involved.
What would you do if you felt a patient's needs were beyond the scope of home health care?
If I felt a patient's needs were beyond the scope of home health care, my immediate course of action would be to prioritize patient safety and facilitate a seamless transition to a higher level of care. My first step would be a thorough, objective clinical assessment to confirm my concerns. This would involve a comprehensive evaluation of their vital signs, mental status, physical condition, and any acute changes that have occurred since my last visit. For instance, if a patient I was visiting for routine antibiotic treatment, such as Ms. Patient's name, suddenly presented with high fever, severe confusion, and a rapid heart rate, it would be a clear sign that her condition was escalating beyond what home care could manage. Once my assessment is complete and I have determined a change in condition is present, I would immediately contact the patient's physician. Using a structured communication tool like SBAR, I would provide a clear and concise report of my findings, explaining why I believe the patient requires more intensive medical attention. I would advocate for the patient's best interest, recommending hospitalization or a transfer to a facility where they could be continuously monitored and receive more advanced treatment. I would also alert the physician to the fact that I am the sole medical professional on site, emphasizing the need for urgent guidance. While waiting for instructions or the arrival of emergency medical services, I will provide any necessary immediate care within my scope of practice to stabilize the patient. For example, I might administer oxygen, position them to facilitate breathing, or simply provide comfort and reassurance to both the patient and their family. I would also begin gathering all relevant patient information, including medications, allergies, and the initial treatment plan, to prepare for a smooth handoff to the hospital staff. This entire process, from initial assessment to transfer, is meticulously documented to ensure a complete record of the patient's care and the rationale for the change in the care plan.
Home health requires a high degree of independence. How do you stay organized and manage your time effectively?
A high degree of independence in home health requires a proactive and highly organized approach to time management. My strategy is built around meticulous planning and flexible execution. I begin each day by reviewing my schedule and the specific needs of each patient on my route. This includes checking for any new orders, lab results, or communication from the care team. I prioritize my visits based on patient acuity and urgency, such as seeing a new post-operative patient first or scheduling a visit to a patient who requires a time-sensitive medication. I also strategically plan my route to minimize travel time between homes, ensuring I can dedicate the maximum amount of time to direct patient care. During each visit, I use a structured workflow to stay on track. I start with a brief conversation to build rapport and assess the patient's immediate needs. Then I systematically perform my tasks, such as vital sign checks, medication administration, wound care, or patient education. I document my findings and interventions in real time on a mobile device or a secure tablet. This practice of documenting as I go is crucial. It prevents me from having to remember details later and ensures my records are accurate and up-to-date for the entire care team. Finally, I build in buffer time to my schedule for unexpected delays or emergencies, which are a reality of home health. This flexibility allows me to handle a sudden change in a patient's condition, address a family's urgent question, or navigate unexpected traffic without getting behind on my entire day's schedule. By combining careful pre-planning, efficient on-site documentation, and built-in flexibility, I'm able to manage my time effectively, provide high-quality, comprehensive care to each patient, and still ensure I am available for any unforeseen circumstances.
Describe a time you encountered an unexpected challenge during a home visit and how you resolved it.
During a routine home visit for a post-operative patient, I encountered a significant and unexpected challenge when I discovered their home's electricity had been shut off. The patient, an elderly individual with limited mobility, relied on an electric air mattress to prevent pressure ulcers, and their refrigerator contained essential medications, including insulin, that required constant refrigeration. The lack of electricity immediately posed a direct threat to both their health and the integrity of their medical supplies. My first priority was to ensure the patient's immediate safety. I moved the patient to a regular bed and used my clinical judgment to assess their skin for any signs of pressure injury. I also explained the situation calmly to the patient, reassuring them that we would find a solution. The next step was to address the critical issue of the refrigerated medications. I immediately contacted the patient's family to inform them of the situation and instructed them to purchase a cooler with ice to store the medication safely until power was restored or an alternative solution was found. I also took the time to educate them on how to maintain the proper temperature in the cooler to avoid spoilage. Simultaneously, I initiated contact with the patient's physician and the home health agency. I used a structured report to explain the emergency, highlighting the risks associated with the lack of electricity and the need for a temporary care plan. We collaborated to find an interim solution, which involved a temporary stay with a relative until power was restored. Before leaving, I ensured the patient was comfortable and the medications were safely stored. By taking immediate action, prioritizing patient safety, and coordinating with the family and the healthcare team, I was able to manage the unexpected challenge effectively and ensure a positive outcome for the patient.
How do you maintain professional boundaries with patients and their families?
Maintaining professional boundaries with patients and their families is essential for ensuring a safe and therapeutic relationship. My approach is based on clear communication, consistency, and a strong ethical foundation. I treat every patient and family with warmth and respect, but I'm always mindful of my role as a healthcare professional. I do not engage in conversations that are overly personal or unrelated to their care, and I am careful to use professional titles and language. I also make sure to wear my uniform or a name badge to clearly identify myself as a nurse. These simple actions help set the tone and expectations from the very beginning. I also believe in establishing and communicating boundaries early in the relationship. For example, I would clearly explain my role and the purpose of my visits during our first meeting. I would also discuss my schedule and how they can contact me or the agency with questions outside of our visit times. This prevents them from feeling the need to call me on my personal phone or expect care outside of my scheduled hours. Similarly, if a patient or family member attempts to cross a boundary, such as offering a gift of significant value or asking for personal favors, I would politely but firmly decline and explain that professional guidelines prevent me from accepting such offers. Consistency is key. Whether it's with a patient I see daily or one I see weekly, I apply the same professional standards to every interaction. This ensures there is no confusion about my role or what they can expect from me. By maintaining these boundaries, I can create a trusting and therapeutic relationship that is focused solely on the patient's well-being and is free from any potential conflicts of interest or misunderstandings. It allows me to provide the highest quality of care while protecting my own professional integrity.
What steps do you take to manage your own personal safety while traveling to and from patient homes?
Managing my personal safety while traveling to and from patient homes is a top priority, and I follow a set of established procedures to mitigate risks. My first step is always proactive awareness and planning. Before I even leave for my visits, I review my daily schedule, paying close attention to the addresses and the travel time between each. I use a reliable GPS and map out my route, avoiding areas that are known to be unsafe or poorly lit, especially during evening visits. I make sure my phone is fully charged and that I have a contingency plan in case of vehicle trouble, such as a flat tire. Upon arriving at a patient's home, I conduct a brief but thorough visual assessment of the immediate environment. I look for things that seem out of place, such as unfamiliar vehicles or any signs of a disturbance. I always park in a well-lit area and ensure my vehicle is locked and secure. I also make sure I have my keys easily accessible to me so I can enter my car quickly when I'm ready to leave. I never enter a home if I feel a sense of unease or if the situation seems suspicious. My safety is non-negotiable, and I trust my instincts. During the visit, I maintain situational awareness. I'm conscious of my surroundings and the dynamics within the home. I also make it a point to keep my belongings, such as my nursing bag, in a secure and visible location. I always carry my identification and a fully charged phone. If a situation were to escalate or become unsafe, I would immediately and calmly excuse myself and leave the premises. Afterward, I would report the incident to my supervisor or the agency's safety department. By prioritizing these steps, I ensure I can perform my job effectively while maintaining a high degree of personal safety.
Why are you interested in home health nursing?
I am interested in home health nursing because it offers a unique opportunity to provide patient-centered care in a setting where it can have the most profound impact. Unlike a hospital or a clinic where the environment is controlled, home health allows me to see the patient as a whole person in their own context. This holistic view is what truly enables me to be an effective nurse. I can assess a patient's living situation, their family dynamics, and their daily routine, which helps me identify and address social determinants of health that are often overlooked in a traditional medical setting. The autonomy and independence of the role also appeal to me. I enjoy the challenge of managing my own time, making critical decisions on my own, and being a key advocate for my patients. This environment allows me to build deeper, more meaningful relationships with the patients and their families. It is incredibly rewarding to witness a patient's progress over time and see them regain their independence and quality of life in the comfort of their own home. I am confident in my ability to assess complex situations, adapt to unexpected challenges, and communicate effectively with a broader care team. Ultimately, home health nursing is where I can leverage my skills to truly make a difference in people's lives by empowering them to become active participants in their own care.
What do you find most rewarding about working in a home setting?
The most rewarding aspect of working in a home setting is the profound sense of connection and the tangible impact I can make on a patient's quality of life. Unlike a hospital where care can be episodic, home health allows me to build a genuine, long-term relationship with patients and their families. I get to know them on a personal level and see them as individuals, not just as a diagnosis. This deep understanding helps me tailor my care to their specific needs, preferences, and lifestyle. It is incredibly fulfilling to witness a patient's progress firsthand, from a state of vulnerability to one of independence. I've had the privilege of helping patients regain their strength after an illness, learn to manage a chronic condition, and navigate the challenges of recovery. Seeing a patient successfully manage their medications, confidently change a dressing, or simply walk to their mailbox on their own after weeks of being bedridden is a powerful and rewarding experience. This kind of progress is often a direct result of the personalized, one-on-one care that is unique to the home health setting. Furthermore, I find immense satisfaction in empowering both the patient and their family. I don't just provide care, I educate, I guide, and I build their confidence so they can take control of their own health. The patient and family are truly partners in the care plan, and I get to see the positive ripple effect of that empowerment within the entire family unit. Knowing that my work helps a patient not only recover, but also thrive in their own environment is what makes home health nursing so uniquely gratifying for me.
How do you handle the emotional and psychological aspects of caring for patients at the end of their lives?
Caring for patients at the end of their lives involves a deep understanding of both the physical and emotional needs of the patient and their family. My approach is centered on providing compassionate, holistic care that prioritizes comfort, dignity, and open communication. I start by establishing a trusting relationship with the patient and their family, creating a safe space where they feel comfortable sharing their fears, hopes, and concerns. I practice active listening, giving them my undivided attention and validating their feelings without judgment. It's crucial to acknowledge that this is a difficult time for them and that their emotions are completely valid. I focus on symptom management and comfort care to ensure the patient is as pain-free and comfortable as possible. This includes administering pain medication as needed and using non-pharmacological methods like gentle massage, soothing music, or simply holding their hand. My goal is to alleviate physical distress so the patient can focus on what is most important to them in their final days. Equally important is my role in patient and family education and support. I provide clear and honest information about what to expect, demystifying the dying process and empowering them to make informed decisions about their care. I am a resource for them, connecting them with social workers, spiritual advisors, or grief counselors. I also encourage them to spend quality time together, creating lasting memories. I understand that my role extends beyond the physical. I am there to offer emotional and spiritual support. This work is emotionally challenging, but I find it incredibly meaningful. By being a calming, reassuring presence and ensuring the patient's dignity is maintained, I can help make this difficult time a little easier for everyone involved.